Have you ever experienced that sudden wave of dizziness when you leap out of bed or quickly rise from a chair? If so, you're not alone. This common phenomenon is known as orthostatic hypotension, and it can be perplexing and even alarming. In this video, we'll break down what it is, why it happens, and share tips to manage it effectively. What is orthostatic hypotension? Orthostatic hypotension occurs when your blood pressure drops significantly after standing up from a sitting or lying position. This sudden shift can lead to a brief but uncomfortable feeling of lightheadedness, dizziness, or even fainting. Typically, the body compensates for changes in posture by adjusting blood flow and pressure, but sometimes this mechanism fails. Common causes of dizziness when standing up too fast. 1. Dehydration. Insufficient fluid intake can lower blood volume, making it harder for your body to maintain blood pressure. 2. Medications. Certain medications, including diuretics, antidepressants, and drugs prescribed for high blood pressure, can interfere with blood pressure regulation. These medications may cause blood pressure to drop too much upon standing, leading to dizziness. 3. Aging. As we age, the body's regulatory systems can become less responsive. This means the body may take longer to adjust blood pressure when moving from sitting or lying to standing, increasing the risk of orthostatic hypotension. 4. Health conditions, heart issues, diabetes, and nervous system disorders like Parkinson's disease can all interfere with blood pressure regulation. Quick reminder: if you're finding this video helpful, don't forget to like, subscribe, and turn on notifications for more health insights. It helps our channel grow and keeps you informed about useful tips and wellness advice. Tips to manage and prevent orthostatic hypotension. Get up slowly. Avoid sudden movements when rising from bed or a chair. Instead, take a few deep breaths and rise gradually to give your body time to adjust. Stay hydrated. Proper hydration helps maintain blood volume, which is essential for stable blood pressure. Drinking water throughout the day can help prevent drops in blood pressure. Wear compression stockings. These can help improve blood flow in the legs and prevent blood from pooling, which can reduce the symptoms of orthostatic hypotension. Increase salt intake. With your doctor's approval, slightly increasing salt in your diet can help raise blood pressure and reduce dizziness. However, this approach isn't suitable for everyone, especially if you have high blood pressure. Avoid alcohol. Alcohol can dilate blood vessels and exacerbate blood pressure drops, so minimizing alcohol intake may help prevent dizziness. Practice leg exercises. Flexing or moving your legs before standing up can help push blood back up to your heart and reduce the likelihood of dizziness. Consult your doctor. If orthostatic hypotension is frequent, persistent, or accompanied by fainting, consult a healthcare professional. They can assess underlying causes and recommend treatments or medication adjustments if needed. This video is for informational purposes only and should not replace professional medical advice. If you have ongoing symptoms, please consult a healthcare provider for personalized care. Thank you so much for watching. We hope you found this information helpful and that you'll feel more prepared to manage any dizziness when standing up. Stay healthy, and we'll see you in the next video.